Breast cancer. It's a phrase that can evoke fear and uncertainty, but knowledge is power. Understanding this disease is the first step in taking control. We'll look at breast cancer stages simply and clearly. This isn't about jargon, it's about empowering you. Staging helps doctors classify the cancer. It tells us the size and spread of the tumor. This information is crucial for treatment planning. Think of it like planning a journey. Knowing your starting point helps map the best route. Understanding the stage helps create the best treatment plan. We'll break down each stage, from 0 to 4. This video is for informational purposes only. Always consult your healthcare provider for any health concerns. We'll journey through each stage, exploring what makes each unique. We'll delve into stage 0, often referred to as non-invasive breast cancer. We'll then move on to stage 1, where the cancer is still relatively small and hasn't spread beyond the breast. As we progress, we'll explore stages 2 and 3, where the cancer might have grown larger or spread to nearby lymph nodes. Finally, we'll discuss stage 4, also known as metastatic breast cancer, where the cancer has spread to other parts of the body. For each stage, we'll look at potential treatment options. Keep in mind that treatment plans are tailored to each individual and may involve surgery, chemotherapy, radiation therapy, or a combination of these approaches. Remember, early detection is key. The earlier breast cancer is found, the better the chances of successful treatment. So, if you notice any changes in your breasts, such as a lump, skin changes, or nipple discharge, don't hesitate to contact your doctor. Let's begin our exploration with stage 0 breast cancer, also known as ductal carcinoma in situ, or DCIS. Don't let the technical term intimidate you. We'll break it down. In the simplest terms, stage 0 means that abnormal cells are present in the lining of the milk duct in the breast. However, these cells haven't spread beyond the duct wall into the surrounding breast tissue. Think of the milk ducts as a network of tiny tubes within your breast responsible for transporting milk. In DCIS, these abnormal cells are confined to the walls of those tubes and haven't broken free to invade nearby tissue or spread to other parts of the body. Now, it's important to note that while DCIS is classified as stage 0 breast cancer, it's considered non-invasive. This means it lacks the ability to spread and form a life-threatening tumor in its current state. However, if left untreated, DCIS has the potential to progress to invasive breast cancer over time. This is why early detection and treatment are crucial even in stage 0. It's all about taking proactive steps to prevent the cancer from potentially becoming invasive. So, how is stage 0 breast cancer detected? Well, it's often found through routine mammograms, even before any symptoms appear. This highlights the importance of regular breast cancer screenings, as they can catch the disease in its earliest stages, when treatment is most effective. Sometimes, DCIS may not show any noticeable symptoms. However, some women might experience changes such as nipple discharge, a lump near the nipple, or dimpling or thickening of the breast skin. It's essential to remember that these symptoms can also be caused by other, less serious conditions. If you notice any unusual changes in your breasts, don't hesitate to contact your doctor. They can perform a clinical breast exam and order further tests, such as a mammogram, ultrasound, or biopsy, to determine the cause of the symptoms. Remember, early detection is key to successful treatment. Don't hesitate to seek medical advice if you have any concerns. Your health is paramount, and seeking timely medical attention can make a world of difference. Now that we understand stage 0 breast cancer and its characteristics, let's explore the treatment options. The good news is that stage 0 is highly treatable, and the goal is to remove the abnormal cells and prevent the cancer from becoming invasive. Surgery is the most common treatment for DCIS. There are two main types of surgery: lumpectomy and mastectomy. A lumpectomy involves removing the tumor and a small margin of surrounding tissue, while a mastectomy involves removing the entire breast. The choice of surgery depends on factors such as the size and location of the DCIS, as well as the individual's preferences. In addition to surgery, radiation therapy may be recommended after a lumpectomy to destroy any remaining cancer cells in the breast. This helps to reduce the risk of the cancer recurring. Hormone therapy, such as tamoxifen, may also be an option for some women to lower the risk of developing invasive breast cancer in the future. The specific treatment plan will be tailored to each individual, considering their overall health, the characteristics of the DCIS, and their personal preferences. It's essential to have open and honest conversations with your healthcare provider to make informed decisions about your treatment. Now let's move on to Stage 1, breast cancer. Stage 1 breast cancer is invasive, meaning it has spread into surrounding breast tissue. The tumor is small and hasn't spread beyond the breast or nearby lymph nodes. Think of it like a seed sprouting roots. The cancer cells have begun to invade nearby tissue. Treatment at this stage is often highly successful. Early detection significantly increases positive outcomes. Diagnosing Stage 1 breast cancer often begins with the same methods used for Stage 0, such as routine mammograms or noticing changes during self-exams. A mammogram might detect a suspicious area, prompting further investigation. Similarly, feeling a new lump or noticing skin changes can be early warning signs. If an abnormality is detected, your doctor will likely recommend a biopsy. This involves taking a small sample of tissue from the suspicious area for examination under a microscope. A biopsy is the most definitive way to determine if cancer cells are present, and if so, what type of breast cancer it is. Beyond physical examination and imaging, your medical team will also consider other factors when diagnosing Stage 1 breast cancer. Your medical history, family history of breast cancer, and any genetic predispositions will all be taken into account to provide a comprehensive assessment. Once a diagnosis of Stage 1 breast cancer is confirmed, your doctor will work with you to determine the best course of treatment. This is where understanding the specific features of your cancer, such as its size, location, and whether it has spread to lymph nodes, becomes crucial in guiding treatment decisions. Treating Stage 1 breast cancer involves a multifaceted approach to achieve the best outcome. The primary goal is to remove the cancer and minimize recurrence. Surgery is common with options like lumpectomy or mastectomy. Adjuvant therapy, including radiation or chemotherapy, may follow. Hormone therapy is also an option for hormone receptor-positive cancers. As we move on to Stage 2 breast cancer, it's important to understand that this stage represents a progression from Stage 1, but it's still considered relatively early in the disease's development. In Stage 2, the cancer has grown larger than in Stage 1, or has spread to a few nearby lymph nodes. However, it hasn't spread to distant organs. Imagine a pebble dropped into a pond. In Stage 1, the ripples are small and contained. In Stage 2, those ripples have expanded further outwards, but they still haven't reached the far edges of the pond. The good news is that even though Stage 2 breast cancer indicates some level of spread, the chances of successful treatment remain high. Early detection and a well-coordinated treatment plan are crucial in managing the disease and preventing further progression. One of the key factors that distinguishes Stage 2 from Stage 1 is the size of the tumor. In Stage 2A, the tumor may be larger than 2 centimeters but hasn't spread to the lymph nodes, or it might be smaller than 2 centimeters but has spread to 1 to 3 lymph nodes under the arm. Let's delve into Stage 2 breast cancer's substages, 2A and 2B. These help determine cancer spread and guide treatment. In Stage 2A, the tumor exceeds 2 centimeters but hasn't spread to lymph nodes, or it's smaller but has spread to nearby lymph nodes. Stage 2B involves larger tumors and more lymph node spread. These factors refine the treatment strategy. Treating Stage 2 breast cancer involves a multidisciplinary approach tailored to the individual's needs. Surgery is vital, aiming to remove as much cancer as possible and prevent recurrence. Options include lumpectomy or mastectomy, depending on tumor size and spread. Lymph node removal may be necessary to check for cancer spread. Adjuvant therapy, like radiation or chemotherapy, reduces recurrence risk. Moving on to Stage 3 breast cancer, we enter a phase where the disease has progressed further, but it's essential to remember that it's by no means a hopeless situation. Stage 3 signifies that the cancer has grown larger and/or spread beyond the immediate vicinity of the tumor to nearby lymph nodes or tissues. However, it hasn't spread to distant organs. Think of it this way. If Stage 2 was like the ripples in the pond expanding further outwards, Stage 3 is like those ripples reaching the edges of the pond and starting to interact with the surrounding environment. While Stage 3 breast cancer is more advanced than earlier stages, it's crucial to remember that treatment options are still available and can be highly effective in controlling the disease and extending life expectancy. Advances in medical technology and treatment approaches have significantly improved outcomes for individuals diagnosed at this stage. One of the key factors that distinguishes stage 3 from earlier stages is the extent of lymph node involvement. The cancer might have spread to a larger number of lymph nodes, or it might have spread to lymph nodes located further away from the original tumor. Stage 3 breast cancer often involves a tumor larger than 5 centimeters, possibly invading surrounding tissues. Lymph node involvement is common, with cancer spreading to nodes under the arm, near the collarbone, or behind the breastbone. Symptoms include noticeable lumps, changes in breast size or shape, skin irritation, nipple changes, discharge, and persistent pain. Always consult your doctor if you notice any unusual changes. Treatment often involves a combination of systemic therapies like chemotherapy and targeted therapies. Radiation therapy is used post-surgery to reduce local recurrence risk. Surgery may be considered if the tumor shrinks significantly after chemotherapy. The type of surgery depends on the tumor's size, location, and patient preferences. Emotional well-being and social support are crucial. Practical assistance from family and friends can be invaluable. Regular follow-up appointments are essential for monitoring and managing side effects. Lifestyle modifications and self-care are important for overall well-being. Stage 4 breast cancer has spread to distant organs. Treatment focuses on managing the disease and maintaining quality of life. Treatment plans are individualized based on the organs affected and patient health. Understanding the disease's complexity helps in managing it effectively. Systemic therapies like chemotherapy and hormone therapy are key. Targeted therapies offer precise treatment options. Local treatments like radiation can alleviate symptoms. Managing side effects is crucial for maintaining quality of life. Emotional and practical support is essential. Seek help from family, friends, and community organizations. Healthcare teams provide guidance on resources and support services. Engage in activities that bring joy and meaning. Early detection is crucial, even in stage 0. Timely diagnosis and comprehensive treatment are vital in stages 1 to 3. Knowledge empowers individuals to advocate for their health. Always ask questions and seek second opinions. Talk to your doctor about concerns and screening guidelines. Regular mammograms and self-awareness are key. Seek support from reputable organizations. Stay informed and connected for strength and resilience. And before you go, thank you so much for watching our video, and please make sure to subscribe to our channel. If you want to watch out for the 7 signs of type 2 diabetes, watch the video on your screen next.